We have several causes of discharge in women, but today we're going to be looking at a particular one which is very common. And I'm sure if you do have vaginal yeast infection, most especially the reoccurring one, the ones that goes and come, you will definitely need this video because we need to know why this infection keeps going and coming back. And we also need to know the medications we can use to treat this condition successfully without it reoccurring back. By now, we should know that vaginal yeast infection is also called vaginal candidiasis due to its causative agent, and about 75% of women at their lifetime will definitely experience vaginal yeast infection, which means it's very common, and we're going to be looking at why it's very common in this video. We're also going to be looking at the causes, the signs and symptoms, and of course how you can manage this condition successfully. Now, vaginal yeast infection is mostly caused by a fungal agent called the Candida albicans, although we have several other kinds of fungal agents that could cause vaginal yeast infection, but this is one of the major ones that causes vaginal yeast infection among women, to be precise. Now, it is very important to know that vaginal yeast infection is not considered as a sexually transmitted disease due to the nature at which it's being contacted or how it's being spread to people, though it could be transferred to other persons via sexual activities. But there are other means you could get this infection outside sexual activity, and that's why it's not primarily a sexually transmitted disease. But the good thing is this condition is treatable. You can treat this infection without it going and recurring back. But before we talk about the treatment, we need to understand why it keeps going and coming back so we can know where to approach it from. Because once you keep treating and you don't even know what is making it to reoccur back, you might be wasting your time while treating yourself. And that's why it's very important to watch this video to the end so you can get the approaches you need to learn on how to treat and manage this condition and how to prevent the things that might be making it to reoccur back so you'll not be wasting your time while treating yourself. And we're also going to look at the home remedies, the things you can do at your end to prevent this infection from reoccurring back and how you can manage this condition from your end. Not just that, we're also going to be looking at the signs and symptoms, the causes, the diagnosis, how you can know, how you can verify if you're having this condition, although that would be from the signs and symptoms. And when it comes to the treatment, I will be telling you medications I will recommend in case you are meeting me for a consultation. Now let's talk about the signs and symptoms you will experience if you're having a vaginal yeast infection. And one of them is itching and irritation. As a woman, you might experience some kind of itching around your vulva area because the vulva becomes inflamed, the vagina becomes inflamed while you are having vaginal yeast infection, and this is one of the major symptoms you might experience when you're having a vaginal yeast infection. In women, you might experience so much pain while meeting your partner because the vaginal lining becomes very inflamed, and once your partner is going in and coming out, you might experience so much pain, and sometimes people might experience bleeding. This is mostly caused by vaginal yeast infection. You might experience other signs and symptoms like pains while urinating or pains after urinating. When you finish peeing, you might experience some kind of pains at your urethra or inside your vagina. When the urine touches any part of your vulva lining, you might experience so much pains there. It's mostly caused by vaginal yeast infection. And in most women, you might also experience some kind of reddish spots around your vulva. On your vulva lining, you just experience some kind of reddish spot there. It's also caused by vaginal yeast infection, and this happens due to irritation caused by the vaginal yeast cells. It's very important to also know that vaginal yeast infection is mostly caused by a candida species called Candida albicans. Although there are other species of candida cells that could cause a yeast infection, but one of the major ones is the Candida albicans, and why we consider this is because it's one of the major species that causes infection to people, and it's located virtually all part of your body. It's located on your skin, your mouth, your gut, your anal opening, your vagina. It's located there to maintain the health of your vagina. But the problem is when the environmental health of your body changes, it now causes these cells to start overgrowing. And when there's an overgrowth in these cells, then that's when you start having the signs and symptoms of yeast infection, and that's when it starts causing problems to your body. And we're going to be looking at all of that by the end of this video. And it's very important to also note the factors that can promote your chances of having a vaginal yeast infection. Now, the major cause is Candida albicans, but there are other factors that can make this Candida albicans to start growing in your body profusely. And one of them is hormonal changes. And this happens either due to pregnancy. When you are pregnant as a woman, your chances of having yeast infection increases. And this happens because there will be a kind of changes in your hormonal level. There will be a spark up in your estrogen level, and the body's hormonal system will just be imbalanced because you are pregnant. So there will be a kind of changes of hormones in your body. And while you are having this, you might have a high chance of a vaginal yeast infection. If you are at your puberty stage or you are using birth control pills, this can increase your level of estrogen. And once the estrogen level in your body increases, then there will be a favorable environment for yeast infection to grow more in your vagina. And that's why you need to make sure you control the level at which you take hormonal pills. In case you're a woman, you need to discuss with your gynecologist because before taking any hormonal pills, so they can check you to know the level of certain hormones in your body before recommending certain birth control pills to you, so that you don't end up having vaginal yeast infection. And this is why most people keep having recurring vaginal yeast infection, because most of them keep using pills and they'll be thinking maybe it's because they're having multiple sex partners, or they're using dirty toilet or dirty water. Sometimes it's not because you're using dirty toilet, or maybe you're using, you are having multiple sex partners. It's because maybe you are using birth control pills that is increasing your estrogen level, and this can increase your chances of having a vaginal yeast infection. If you're that kind of person that is diabetic, people that have an uncontrolled level of sugar in their body will definitely have high chances of having vaginal yeast infection, because candida cells feed more on sugar. So when you are having an uncontrolled level of sugar in your body, then you have a chance of having vaginal yeast infection, because these candida cells would easily feed from this sugar. Now, if you are having HIV, immunosuppressing diseases that can reduce your immune level, that can make you not to have good level of immunity in your body, then you might have a vaginal yeast infection, because once you are having a reduced level of immunity, then these infections can come in and your body will be compromised. Now, people that wear tight underwears, you wear non-breathable underwears. As a woman, you're wearing pant, you're wearing tight, you're wearing skirt, you're wearing trouser, you're wearing gown on one genital organ. This can increase your chances of having vaginal yeast infection, because vaginal yeast infection thrive more in moist environment. So once you are using all of this to cover your vagina, it can make your vagina to be wet. It can make it to always be moist. And once it's moist, that's when yeast infection starts looking for a chance to enter. Now, if you're always using sprays, using soap to wash your vagina, you're using perfume and other things like that to wash your vagina, this can increase your chances of also having vaginal yeast infection, because normally vaginal yeast infection will not grow in a place that don't have an imbalanced pH. So once you're using these sprays, you're using soaps and other stuff like that in your vagina, this can change the pH of your vagina and to give more comfortability to vaginal yeast cells. And that's why you must avoid anything in the vagina. In fact, the vagina is self-cleaning. God have made the vagina to be self-cleaning. It made it to clean itself naturally. So you don't need to wash your vagina at all. Leave it alone. It will clean itself. And that's why you keep having yeast infection. Because some of you keep complaining that I've been having yeast infection and you don't know what is happening. I've been washing myself. If you ask them questions, they will start telling you, I've been using soap, I've been using clean water. This can increase your chances of having vaginal yeast infection, because vagina does not allow such things inside. So you need to allow the vagina to stay on its own. Now, talking about the home remedies, there are so many other things you can do at your end to make sure you reduce your chances of having vaginal yeast infection, or to manage vaginal yeast infection. And one of them is yogurt. Yogurt can help in managing vaginal yeast infection, and I'll tell you how. Now, yogurt contains lactobacillus. Lactobacillus is a normal flora, a bacteria that is meant to be in the vagina. God created it to be there, and this bacteria helps in maintaining the health of the vagina, help in maintaining the pH of the vagina, to prevent the candida cells from growing. So once these bacteria are no longer there, by either maybe you abusing antibacterial medications, you taking antibacterial medications anyhow, these bacteria can die off, and that's when you have a high chance of having a vaginal yeast infection. So once you take yogurt, it will increase the level of these bacteria in your vagina. And one of the ways you can use this yogurt is by drinking it or by applying it on your vulva. Now, doing this will help you grow the natural healthy bacteria in your vagina. And once these natural healthy bacteria are there in your vagina, then there will be no chance for vaginal yeast infection at all in your vagina. Now, it's very important to know that the yogurt you're using must not contain sugar, because if it contains sugar, then the vaginal yeast cells will start feeding from that sugar, and there will be an overgrowth of these yeast cells. So you must make sure that the yogurt you're using does not contain sugar, and it's a natural yogurt, because natural yogurt are the only ones that contains these lactobacillus that are healthy for your vagina and healthy for the growth of these natural and healthy bacteria in your vagina. Now, using boric acid is also a home remedy, something you can do at home to prevent your chances of having vaginal yeast infection, or to manage vaginal yeast infection, because boric acid is an antiseptic. Now, using it in your vagina, because it's been inserted inside the vagina, and once it's been inserted inside the vagina, it changes the pH of the vagina. It makes the pH of the vagina to be favorable for the body, not for the yeast cells. So once the environment of the vagina is not favorable for yeast cells again, then they will have to leave your body. And that's how boric acid manages yeast infection. Now, sometimes you might not use boric acid alone. You might need other antifungal medications, which you're going to be discussing later in this video. Now, you might also need coconut oil. Now, research have proven that coconut oil is antifungal. It contains an antifungal property. So if you are having a vaginal yeast infection, you can also use coconut oil, pure coconut oil, to apply on your vulva or on your vagina to prevent the growth of vaginal yeast cells. And there is what we call the apple cider vinegar. Now, this apple cider vinegar have been proven to manage vaginal yeast infection effectively. And if you are having a vaginal yeast infection, what you need to do is to get a little part of apple cider vinegar, drop in a warm water, and soak your vulva or your vagina in that warm water for at least 20 minutes. By doing this, it will eliminate all the unhealthy bacteria in your vagina, and it also will eliminate all the yeast cells in your vagina, and you'll be safe from vaginal yeast infection. Now, you might also need garlic. I know most of you might have been hearing garlic, but you don't know if garlic can actually help in vaginal yeast infection, but it can also help. If you are having vaginal yeast infection, what you need to do is to add more garlic in your diet. By doing this, you will also increase your level of immunity against vaginal yeast infection. Now, when we talk about treatment, there are so many medications that can help in managing vaginal yeast infection. So if you might have tried all these home remedies I've just explained and maybe it didn't work out for you, or maybe you might try to add other medications, or you want to add other medications to the home remedies you are putting in place, then this is the best time you will need to pay close attention to everything I'm going to be explaining. But mind you, these medications would best be effective once they are being recommended by a medical personnel, because once you use this medication not under doctor's prescription, sometimes you might not get a good result because they might have their own side effects and they might not be favorable for you, and that's why you need to visit a gynecologist or visit a medical doctor so he can recommend the medications that will help you in managing your specific kind of vaginal yeast infection. Mind you, I said there are different strains of candida cells that can cause a vaginal yeast infection, and that's why you will need a doctor's prescription before taking any of the medication. Now, one of the medications I will always recommend in case I have patients that are having vaginal yeast infection is fluconazole capsule, taconazole suppository, which is mostly inserted inside the vagina in case there are vaginal yeast infection. Nystatin suppository, which is also being inserted inside the vagina. There's the taconazole ointment, which is applied on the vulvar lining to prevent the growth of vaginal yeast cells on the vulva, and also to manage the irritation caused by vaginal yeast cells on the vulva. You might also need medications like ketoconazole. They are all antifungal medications that can help in managing the candida albicans. There's also what we call the terbinafine. This is also a strong antifungal medication that can help in eliminating fungal cells from the vagina completely. But you need a doctor's prescription for all these medications. Mind you, these medications will have their own side effects if not being taken under doctor's guidance and prescription, because all medications have their own side effects, and you will need to know the one which is more sensitive to your system before you can start taking them, because there might be allergy. You might take any of them and you start having allergic reactions to all of these medications. So you will need to make sure you consult with the doctor before taking any of these medications. And after watching this video, if you have questions you want to ask about this particular topic, or you have an experience you want to share with us, please do well to drop it in the comment section so I can respond to you as soon as possible. And in case you have not subscribed to our channel, please do well to subscribe to our YouTube channel so you can get more amazing videos like this. And in case there are topics or there are questions I have not answered about yeast infection, please do well to drop them in the comment section so I can look over them and give an answer to them. Thank you for watching this video. I'll see you next time.